So over time, our teeth get stained from coffee, red wines, teas, different drinks. And tooth whitening is a great way for us to remove a lot of those stains. And during that time, one of the things that patients have to be wary of is as you're bleaching, your tooth becomes a little bit porous. And so if you're drinking red wine, if you're drinking coffee, there's a potential for it to look worse, even though you're still pulling those stains off. And you'll still pull them off when you bleach again. So we try to tell them to abstain from really dark staining foods or use a straw when they're drinking for about 2 weeks. So for patients who are whitening, they get a custom tray that fits their mouth specifically. They can use the bleaching trays to whiten their teeth, as well as if their tooth becomes sensitive from the bleaching, we provide them with a tube of potassium nitrate, which will eliminate the sensitivity after bleaching.